Nuclear medicine is a specialized medical field that employs small amounts of radioactive materials known as radiopharmaceuticals to diagnose and treat a wide range of diseases. One of nuclear medicine's most important uses is in oncology, where it is essential for the early discovery, staging, and ongoing monitoring of various cancers, thereby improving patients' outcomes and overall survival rates. Nuclear medicine, as opposed to other imaging modalities like X-rays or CT scans, can reveal important details about the biological processes that take place within organs and tissues. It provides a non-invasive approach to view the metabolic activity of malignancies and their surrounding tissues in the field of cancer. This enables physicians to assess the aggressiveness of tumor, determine its response to treatment, and make informed decisions regarding the most suitable therapeutic approach. Today on your favorite Health TV talk show, The Physicians, we are going to explore the pivotal role of nuclear medicine in oncology, highlight its contribution to accurate diagnosis, personalized treatment strategies, and improved patient well-being. It's another day on your favorite Health TV talk show, The Physicians, where your health is our business. My name is Dr. Rebuna Yusuf Kadri, and of course with my usual lovely co-host.
My name is Dr. Maxina Agbeye. Welcome to your regular Health TV talk show, The Physicians, where your health is always our business.
So Dr. Martina, today is a good day, special day for us. We have
I love your colors, actually.
Thank you. I'm feeling babbish.
Okay.
Dr. Maybe
Sweet.
Babby.
Yeah, looks sweet, really.
The Babby shrink.
Yes, you're right. You look really good, true. Trust me.
Thank you. So we have a very rare privilege of talking about something that is not so common, nuclear medicine.
Nuclear medicine. When you hear that word, nuclear,
it sounds so like as if you're on the moon.
Yes. The astronauts, you know.
And it's I think there are just about 20 to 25 physicians that are specialists in that area in the whole of Nigeria. And 200 million plus people, so you can imagine.
Just about 20 to 21 persons, medical doctors that are in that particular field. And what beats me is that we don't even have that in our residency programs.
Yes. So that means
they're all trained outside Nigeria.
A possibility of them coming back in this Jackpot syndrome.
For those that are practicing, I give them kudos. Those that are practicing here, that actually are using it.
Yes, few, and even globally, it's not like they are. It's such a. But here in Africa, for them in Africa, there's fewer. But you won't compare that to a place like South Africa. But in Nigeria, West Africa, fewer.
Do you have any reason why we don't have it in our curriculum? Why we're not doing that in residency?
It's something that we need to look at, especially in the radiology, because we have radiology,
yes,
right? And we know that in other parts of the world, like for example, let's take US as a case study. If you have to do nuclear medicine, you have to do radiology
first.
And nuclear medicine is a subspecialty in radiology. So maybe in Nigeria, since we already have radiology, we can actually have it as a subspecialty.
Okay.
And who are the people that are best in starting that? These 20 to 25 members that are already
true.
Come set up. At least let's start with maybe geopolitical zone, UCH or Lagos in the southwest, Abuja in north central. You know, that's kind of thing. Kaduna in northwest. You know, those.
Because the advantages, the importance of studying that is can't be overemphasized. Because we will know the role of nuclear medicine in diagnosis.
About the role in oncology, and that is oncology, which is a mess right now. But it's good we have an expert here who is going to, school us about what nuclear medicine is about. Role in oncology. We'll be right back after this time out. Do stay tuned.
Every day and in every way, enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Welcome back. If you are just joining us, this is your favorite health TV talk show, The Physicians, where your health is our business. Today we are talking about a very important topic, and a topic that you may not even be aware, or you may be here and you never have an encounter with this special aspect of medicine. And we are going to deep dive into this topic today to enlighten us on its importance. And the topic today is nuclear medicine and molecular imaging, the role it has to play in oncology. And of course, with us in the studio is the dynamic, beautiful, talented, brainy, walking encyclopedia, no other person than Dr. JALEELAT MOMODU, who is a nuclear medicine physician and molecular imaging specialist, trained in South Africa. But of course, our work experience is not just in South Africa, it has spanned across the Middle East. Dr. JALEELAT, you're welcome.
Thank you for having me.
Nice seeing you and having you on the physicians. We're actually very privileged to have you here.
Do you understand
Just 22 physicians that studied this in Nigeria.
Yes,
and yes, just that number, and you're able to come on our program. I think kudos.
Welcome, Dr. JALEELAT. Like us, we always say, and we promise you on this show, the physicians will always bring you the best. And today we are bringing you somebody who is supposed to be in the museum, because there are very few in the country, right? And today we have Dr. JALEELAT. Dr. JALEELAT, we really appreciate you coming here. So
thank you for having me.
The very first question I want to ask you is, what is molecular medicine, and what is nuclear medicine and molecular imaging? Because it's good for us to break it down for our viewers to understand.
Absolutely, thank you. So nuclear medicine is a specialty of medicine that uses small amounts of radiation, which we'll call radiopharmaceuticals, and we use them to image patients. Now, these radiopharmaceuticals are very small amounts of radioactivity which are safe. And then we can administer them intravenously, orally, or by inhalation, depending on the system we are imaging, to get some diagnostic information. So the concept of molecular imaging is you are looking at diseases at the molecular level. So you are looking at the physiologic properties of these diseases, and you break it down to the molecular level. And this information is what we use in imaging. The concept is that before structural changes occur, you have these physiologic changes, which are changes in function. So another term for molecular imaging is actually functional imaging. So you're imaging function, and that is what you use to image the patients and get diagnostic information. Another aspect of nuclear medicine which is growing now is the therapy aspect. So this same information is what we now use in treating different conditions. For now, the therapy in nuclear medicine is mainly focused on oncology, and we use the same properties of cancer cells to image and then treat conditions. So that's a basic summary of what nuclear medicine or functional imaging is.
Okay, so you just talked about the basic way it actually hits down to the cells, right?
Yes.
So how does this differ from radiology?
Which we all know.
Which we all know.
Yes.
Yeah.
So another term for radiologic imaging would be structural imaging or morphological imaging,
Okay.
where you're actually imaging a structure,
Okay.
as against nuclear medicine or molecular imaging, where you're imaging function. And the difference in terms of the actual imaging process is, like I said, for nuclear medicine, we have a radioactive material which we administer to the patients.
Okay.
And then as the radioactive material moves through the body, it emits that radiation. This is what the camera picks up. So the radiation is coming out of the patient and is picked up on the camera, and then the whole electronics will now convert it into an image that the doctor can read. What radiology does is opposite, in that the radiation comes from an external source. So for example, an X-ray, and then that source passes that radiation through the patients, which the camera picks.
Okay.
So nuclear medicine is almost like radiology inside out.
Okay.
So yeah, so the emission is coming from the patient, while in radiology, the
From
emission
outside,
comes from outside and goes
outside.
through the patient. So that's the basic difference.
Okay, so it's from actually the radioactive substance that you put on the patient?
Exactly.
Okay.
Yes.
This is quite
It's really interesting. So
Contrast.
is this specific? For instance, if you have to apply this in an area like the breast or the kidneys, you go specifically to those areas?
Yes. So what we have in nuclear medicine, we have a very wide range of radioisotopes or radiopharmaceuticals, which are tailored to the specific system or organ you want to image.
Okay.
Because, like I said earlier, you are looking at the physical properties of that system or that tissue or that cell, and that is what then determines the radiation or dye that you use.
Okay.
So, for example, if I was going to image kidney function,
Okay.
I will use a different radioisotope
Okay.
to if I was going to image the breast or the thyroid or something else. So you have the radioisotope on one hand, and then you have like an inert material which simulates normal physiologic function, and then you tag them together.
Okay.
So for example, if I was going to image the thyroid gland, I will want to inject a tracer that I know would be attracted to the thyroid. So we use the receptors on the thyroid gland, and we inject, for example, radioactive iodine, because we know that the cells on the thyroid gland attract iodine. So we give iodine, but a radioactive form that goes to that thyroid gland, and then we can see the radiation. So it's the same concept. So we have our radioisotopes, but then we change what we tag that inert material we tag it to changes depending on the organ you want to image.
Okay, sorry, I want to just ask this. We know if you are doing X-ray,
Yes.
the area that you want to actually get the image from, that is the area you will expose.
Yes.
Okay, for this one, now you're talking about injecting. If you want to do something that has to do with the kidneys,
Yes.
so what do? How do you go about it?
So
Because I know if it's normal one, we'll expose the areas, right?
Yeah.
Where the kidney is.
Yeah.
But for this, you're talking about isotopes and all those ones.
Yeah.
Because if you inject, we know, if you inject something in substance in the body, it goes through the blood, right?
Yes.
To the whole system. So
Yes.
how do you want to do that?
So everything you inject through the
veins,
veins has a path it goes to.
Yes.
Through the lungs and then
True.
into the systemic
Yeah,
circulation.
yeah.
That's pretty standard. So interesting you asked about the kidneys, because the kidney is one where we actually do an intravenous injection, but we start imaging immediately that injection
goes in.
Because we know that it goes through the systemic circulation and goes straight to the kidneys. So we are talking about seconds here. So the way you position the patient is, obviously your detectors will focus on the region of the kidney, but you will still inject intravenously.
Okay.
And then you start acquiring your images immediately you give the injection. Unlike, for example, a bone scan where you would wait 3 to 4 hours for the bone to actually take up, absorb the tracer before you now begin to acquire images. So like I said, we image physiologic process, so there's no one size fits all. Depending on the system you're imaging, you have to adapt and change your protocol, your imaging protocol, to get the best diagnostic information.
Okay.
This is so interesting, and we don't want to take this away from you, because as you are saying and talking and explaining,
a lot of
I'm
things,
asking myself
yeah.
that, do you have to just go and say you want to go and do nuclear imaging, molecular imaging, or do you have to wait for a physician to refer you to for all these scans that you want to do?
Yeah.
Let's keep it up with the physicians, and let's hear from you. Have you ever heard of nuclear medicine? And do you know what it is, or have you had scan in recent times? And did anybody ever tell you that they went for a specific test and it sounds, out of place to you? We'll be right back after this time out. Do stay tuned.
No, bro, I don't know anything about it. Bro.
Nuclear medicine.
Yes.
Oh, I don't know much about that, but from my biology, nuclear means something has to do with the cells. So that means that probably medicine that targets the nucleus of cells. So probably you're talking about healthy generation of cells, or making cells more capable, or how will I say, they generate faster.
Every day and in every way, enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Welcome back. If you're just joining us, this is your favorite Health TV talk show, The Physicians, where your health is our business. Today on the show, we'll be talking about nuclear medicine and molecular imaging, the role it plays in oncology. And with us in the studio is the amazing and dynamic Dr. JALEELAT MOMODU, who has been schooling us on so many things when it comes to nuclear medicine. One particular thing she said was the fact that when you look at radiology generally, we are imaging what we call the bony or structural part of any specific organ. While when it comes to nuclear medicine or molecular imaging, we are talking about the functional part of that organ. And you can use nuclear medicine to make diagnosis, do staging, and of course in therapy, because it has a very unique role it plays in oncology. Dr. JALEELAT, before we went on break, I asked a particular question, like, what all this you have been telling us, do I just send myself for molecular imaging just to be clear about, in case maybe I go and do CT scan, MRI, it's telling me all is well, and now you are saying that some things, like, is it prostate cancer?
Yeah, prostate.
Before you can see some certain things, you take like 18 months. Meanwhile, nuclear image and molecular imaging or nuclear medicine, you can see it right away. Do you have to be referred, or do I have to refer myself?
You definitely have to be referred for a nuclear medicine scan. Nuclear medicine imaging is not to replace conventional imaging. We're actually complementing or complementary to conventional imaging. So typically the referral doctor, who is the physician seeing the patient, would decide on if a nuclear medicine scan is indicated. And then we interface a lot with the referral doctors, because most times they know they have a question, but we will then advise on the best scan to do to provide the information that's required.
Okay, so I need to allay the anxiety of most of my viewers out there. Back to where we started, okay, when I asked the question about how you position the patient. If you need to, if you know X-ray, you position and you do that specific area. And for nuclear medicine, you need to inject the radioactive substance. So now, how safe is it? Because we know when we are doing the normal X-rays, they will ask the patient, and the person who positions you will run away and to go and start it, and ask the relative to even leave. If the relative even have to stay with you, they have to say, put your face away and just point. Okay, now it's not like that. You are going to inject something that goes through the blood, the whole system. So how safe is it?
So comparatively, nuclear medicine imaging is safe. We use ionizing radiation, like I explained earlier, but the amount of radiation that the patient is exposed to is comparable to what you would be exposed to in your everyday life. Like we know, in our everyday life, we're exposed to background radiation, either from cosmic rays, from the earth. You take a long distance airplane flight, you are exposed to radiation. So what we then do is we are using the concept of as low as reasonably achievable to get the diagnostic information required, because we know that exposing this patient to radiation, even though it's safe, you don't want to expose the patient unnecessarily. So the amount of radiation you give comes into play. I'll give an example. If you do a thyroid scan, which takes a small amount of radiation, what you're exposed to is equivalent to a flight from what you'd be exposed to if you took a flight from the US to Japan, for example.
And that's a long,
like
16 hours.
Now, the higher amount of radiation you will get would be when you now want to administer it for therapy. But even then, the risk, for example, of getting a secondary cancer or dying from radiation exposure from a PET scan, which has like the highest amount of radiation for image on the imaging side, would be equivalent to the risk you get if you fall from the staircase and die in your life.
You just said PET scan for my viewers. What is
PET scan is called positron emission tomography. So it's one of the scans we do in nuclear medicine. It's the same concept like I explained earlier. We just use different radiopharmaceuticals which have higher energy and comparatively higher radiation, because they give higher sensitivity and higher quality images.
And more precise.
Yes, and more precise. So it's a different type of camera from, for example, your SPECT scanner, which uses a lower energy radioisotope. It still gives the information, but each one, you would use each one depending on what you're imaging and what information you're trying to get.
So this two-pronged approach question I want to quickly ask is, number one, we have just 20 to 25 nuclear medicine physicians in Nigeria. How available are these services in Nigeria? And the other part of it is that, you know, some people react to contrast when they go for CT scan. How do you deal with that in nuclear medicine and molecular imaging? Because that is a very key thing.
Especially as it's going IV intravenous.
Yes.
Okay. Thank you for the question. Let me answer the second question first.
Yeah.
So the radioisotope itself does not have contrast. So it doesn't, you are not worried about contrast allergy when you give your radioisotope. But the thing is, currently the new generation cameras are what we call hybrid cameras, meaning that you have functional and structural imaging occurring at the same time. So for example, a PET CT scanner will give you PET information, which is functional information, and also give you CT, which is anatomical detail. So in those patients, because of the CT aspect, you may want to give contrast. But if a patient has contrast allergy, you don't give contrast. But that doesn't stop you from acquiring the images and getting the information you need.
Okay.
So how available are these services?
Okay, so we are very few nuclear medicine physicians from Nigeria. Some of us are not in Nigeria. But I know that we have nuclear medicine centers in University College Hospital Ibadan, National Hospital Abuja. Those two I'm sure of. There might be other centers, I don't know. But in Lagos, there are two private hospitals that operate nuclear medicine. But I think that with adequate education, enlightenment, and government support, this would increase over time, and then maybe we'll get to train more nuclear medicine doctors.
Thank you very much, Dr. Jalila. Of course,
I'm going to bring her back, definitely.
We can't be saying a walking encyclopedia that's not allowed to go back.
No way.
Possible. Thank you so much for this brilliant enlightenment of this very important topic. And of course, at this point in time, you've just heard from our guests, and for you, our viewers, please always pay attention when we call on you, if you are in Nigeria, 7:30 p.m. West African time, to be with us for just 30 minutes to enlighten you on the current trends and recent development. Molecular medicine and molecular imaging and nuclear medicine, the role it plays in oncology is very important. It's just trying to tell us now from our guests that there's no specific difference. It's a complementary way of medicine to other existing technologies that we already have, like the CT scan and, of course, the MRIs. And it deals more on the functional part of the organ as against the structural part of the organ. My name is Dr. Memuna Yusuf Kadri, and of course, till next time, remain blessed.
So I join my voice to that of Dr. Memuna to just say thank you for coming on our program, Dr. MOMODU. And I'm sure we'll call on you again for more topics that we handle. And I've just want to say thank you again for being part of our program today. Remember to follow us on our social media platforms, on Instagram, on Facebook, and Twitter. Of course, on YouTube, we have over 280 episodes. You can binge on them, and if you want to be part of the program, like Dr. MOMODU, just send us an email, and we'll welcome you. My name still remains Dr. Martina Agbemie. Till next time, stay blessed.